I wanted to bring today's episode to the podcast talking all about the immune system. A lot of times we're on the fertility journey, we're trying to push our body with hormones, doing IVFs and IUIs. But what if our immune system is struggling and that's the reason we're not able to procreate? Maybe you're getting poor embryos or the retrievals aren't working. So today we're talking all about the immune system and what you can do to improve your chances of pregnancy success. Let's go. Hey, Dr. Sarah, excited to have you on the podcast.
Hi, thank you so much for having me. I am so excited as well. I love fellow Canadian shows. It's always so much fun to support people in our own community.
That's right. Awesome. Well, excited to chat with you. If you could just really share with us how you came to do this work.
I think my journey is similar to so many people. I was in and out of hospital much of my life, to be completely honest. I was diagnosed with celiac disease when I was 18, and that really got me interested in naturopathic medicine because it was a naturopathic doctor. Back in the day, naturopathic medicine wasn't what it is now, right? My mom was told to take me to some witch doctor. She told me to go talk to my doctor, and it really started the ball rolling. But I did what everyone does, and I avoided my calling. So I went into research and I deviated from that, and I kept getting handed natural health compounds. And this was during a period of time that I was going through a lot of my own health struggles. So I had not had a period in 5, almost 6 years. No one could figure out why. They just said to me, okay, you're going to have to, if you ever want to get pregnant, you're going to have to come and see me and I'll give you a pill and we'll see if it works, but you're probably not going to have children. And at that point I was in my very early 20s, and it really just rocked my reality. And I think going through that process and being in research really led me to stay super curious. So I used my own skill set to pick apart what could be going on and was able to successfully bring back my period. But when I did, it came with a lot of chaos and a lot of severe and chronic pain. And so then it was like, okay, well, now you have endometriosis, so you definitely can't have kids. And my background is in the immune system and hormones and how they work together. And so that's really the rest of the story. I went into naturopathic medicine to use the research that's available and to be able to apply that to patients in the moment that we get that research. And it's really taken me to where I am now. So now we have clinics across Ontario and BC, soon to expand on that. And really just trying to create that space between the research and when it comes into practice, which can take 10 to 17 years, and shrinking that to give people, especially people with such vulnerable hormonal immune challenges who are told, I don't know what's going on, to give them that option for care, because it's a huge gap right now.
Yeah, exactly. It's empowering. You can do something. Now you just get the diagnosis and then go down a rabbit hole of thinking, you're doomed, when that's just not the case.
Absolutely. And I think we've seen so much through the pandemic how hormones have changed with inflammation. We've seen so many people, like prior to the pandemic, I think I had a handful of people who had a high FSH. They were told they were on the spectrum of premature ovarian insufficiency, and that number's gone up really substantially. And that's because of that hormone immune connection. So there's so much to unpack, but I think staying at the edge of that research is really what makes a big difference, if I'm honest.
Yeah. So let's go into this immune dysfunction and really how that impacts hormones. What are you seeing there?
Yeah, absolutely. So when we're looking at the immune system, I think it's a concept that can be so hard to get your mind around, right? And what I always say is your immune system's job fundamentally is to save your life. It doesn't know the difference between a bacteria or a virus that's living in your gut and a bacteria or a virus that could change your life. And so really the immune system's job is to consistently resource itself, to consistently make sure that it can do its job. And that results in us damaging and depleting other systems of the body. And so there's a few different big components to how the immune system is affecting hormones right now. One of them is, I always say, like way back to biology, right? We hear about the energy powerhouses of our cells, our mitochondria, that little battery, the thing that we are working so hard on to improve egg quality and energy and all of those components, but they're what's making our hormones. This is why we work on them. This is why we focus on them. And inflammation dramatically impacts that system. We know that part of the reason why we need to work on egg quality and hormonal balance, whatever that means in all of those pieces, right, is because that inflammatory impact on the body, that immune system taking action and trying to protect itself, is creating so much collateral damage. Because I always say, you do not, from your immune system's perspective, if you could die tomorrow, because it doesn't know it's a minor infection or a major infection, it just knows something's going on. From its perspective, we don't need hormonal balance and happy periods and painless flow and to get pregnant on the first try. Like, we don't need any of that. It's just saying, like, are you going to be okay tomorrow? And so our job as practitioners in advanced women's health is to go through and to say, okay, where are we at with respect to what we know about bacteria, viruses, your past history of exposure, how food is affecting your body, how nutrient deficiencies are affecting your body. We go through blood sugar. Is blood sugar dysregulation? Most people don't think about it this way, but it's a huge source of inflammation. So we go through those things and we say, is there an obstacle that we can eliminate here? Is there an obstacle that we can support to allow you to be in a space where your hormones function, right? Where you can make enough estrogen at the right time, where you can make enough progesterone at the right time, where your brain can talk to your ovaries efficiently, because that research has also come out extensively after the pandemic, that inflammation changes how your brain and your ovaries talk. And so we go through that first line to understand those connections, which we can get into so much deeper today, and create this opportunity to then kind of move to the next step, which is when we get into, especially with fertility, what's happening at the lining of the uterus, right? Like, it's one thing to make an egg and to develop hormones. It's another thing for the immune system to allow that to implant and embed.
Yeah. And so what are some, I guess, some things we're seeing there? Like, because a lot of people are just like, my goodness, I got this low AMH or high FSH, or I got endo or unexplained, whatever it is, the
Yeah.
diagnosis. And then they don't really think to look. I'm like, well, how's the rest of your health? And then many times they'll be like, it's okay. But if it was optimal, you'd be pregnant. So, and so some of these little niggling issues we have, and we maybe take a pill for it, or we just sort of think it's normal. We just keep putting up with it. Like, what are some signs here that, something has gone the wrong way?
Love it. And I love what you're saying from so many perspectives, because one of the perspectives is that I believe endo is a spectrum. So if we use endometriosis as an example, right? And there is, I think, subtypes of endometriosis, and the research is coming out to suggest that's probably true. If only 25% of people, 30% of people are being diagnosed, then we need to review those symptoms. Because if you have a high FSH, a low AMH, if you're in that situation and you have pelvic pain, you have pain with periods, you have pain with intercourse, you have loose bowel movements, we get deep here, everyone, right? With your periods, and you're not getting pregnant, the chances are that you have what pelvic inflammation. And out of the causes of pelvic inflammation, endometriosis is up there. We have seen this get worse. The research shows there's a 4 to 5 times worsening of symptoms post-pandemic. That is for so many reasons, right? That is because the virus is actually creating inflammation in your pelvis. That is because diet and lifestyle have changed. That is because the exposure, like the sanitization, right? All things that were necessary, but they have impacts on the body and they have impacts on the immune system. So those are some key symptoms from an endo standpoint that we're looking at for sure.
Yeah, the jab itself too, how that has impacted people's cycles.
I was like, I don't know how deep I can go here, but the research is clear, right? Even for me and myself, like I always said, I didn't have any symptoms with COVID or the vaccine except severe pelvic pain. Like I had 2 unmedicated births, and it was worse than that. So We've seen that. We've seen that there's 3 to 6 months of hormonal changes at minimum that can happen. And now we're seeing premature ovarian insufficiency because of how the virus has affected either the ovary itself or how the brain talks to the ovary. So we're seeing two different patterns show up. And this can show up as PMS and PMDD. Shortening cycles is a big one. If you have a cycle that's less than 24 days, you really need to get investigated. It is endo or some kind of dysfunctional pattern, especially if they're going short and then long, right? If you're going short cycles and then getting much longer cycles, 60, 90 days, that's where I don't care if you're 20, you need to get that looked into, because we're seeing a lot of those patterns show up where, like just this week, we had a 22-year-old that had an FSH of 45. Right. So those symptoms that we're told as women are normal and that we should deal with. Periods being all over the place, pain, disrupting our quality of life, the mood fluctuations, night sweats, hot flashes, any of those things in my mind require an investigation, because they mean something different now than they did 5 years ago.
Yeah, and those frequent infections too. If you're like someone sneezes beside you and you're the one, in bed for 3 days after it, like flus and colds, and you just can't, then you take a bunch of antibiotics to, get yourself back on your feet, like that slow wound healing. If you're just like crawling around, you're exhausted, there's a level of being, busy and tired. Then there's like, just can't even, when you have your full 8 hours and you're still dragging your butt. And then a lot of those like digestive issues too, or loose stools or constipate, like swinging back and forth. I see a lot of people swinging back and forth with that. And then like the autoimmune diseases, which are through the roof right now. So we see a lot of people, obviously, you have autoimmune with celiac. We see a lot of celiac, hashies going along with, low inflammation, high FSH, rheumatoid arthritis, lupus, MS, all of this piece. And the body's on fire. And then I see people, hey, let's go to IVF and push this, and wonder why you have poor response and nothing's working. Well, the body's under attack, and just taking some thyroid medication is not going to get you the results that you're looking for. Like, we've got to boost up the immune system, even if you had COVID or the flu or whatever it is, you got, or if you got the jab, we have to boost everything up to be able to sustain life. Because I see so many people that, I had my first pregnancy. No, like, I just literally got the phone with someone just before this. She had an easy first pregnancy, got pregnant on the first try, and now all of a sudden, out of the blue, POI. Yeah. And it's sort of, we think it's out of the blue, but like, you've just sustained life. You've had, your postpartum period, you're breastfeeding. And so all this, stress on your body. And now how do we right the ship? And so it's not about thinking we got to go to donor eggs and people are told adoption and all this piece. Like, there's things to do, which is empowering, because conventional medicine will just pass you a pill and have you thinking you're doomed.
Absolutely. And I think it's such an important conversation, because years ago, 99% of my patients with POI had Hashimoto's. There is a direct connection between the antibodies against your thyroid and the antibodies against your ovaries. Now we're in this situation where there's a couple different categories. So you can have POI, or what looks like POI, because sometimes it looks like POI, but then they go into a fertility cycle and there's like their AFC is fine. So there's ovarian suppression, and then there's ovarian damage. Ovarian damage can be caused by anti-ovarian antibodies, which can happen with other autoimmune conditions. We say as soon as you have one, you could get another every 3 to 5 years. So essentially what that means is your immune system sees your ovary as a bacteria or a virus and tries to kill it. So you can have it with anti-ovarian antibodies. You can have it with anti-thyroid antibodies. You can have it with what we call anti-nuclear antibodies. And then we see, again, the march of implantation with antiphospholipid antibodies, anti-mitochondrial antibodies, et cetera, anti-cardiolipin antibodies. So there's this whole category of autoimmune where it's damage-based. There's damage at the level of the ovary. The mitochondria is damaged. A virus can get in there even without antibodies, which is what we're seeing. I'm going to get really nerdy for one sec, work with me. But there's a receptor. It's called an ACE2 receptor, ACE2. And that is how any what we call crown virus can enter. So COVID was an example of a crown virus. It can enter into a tissue. And so it can enter into your thyroid. It has ACE2 receptors. It can enter into your liver. It can enter into your ovaries. It can enter into your lungs, your heart. And so we see the virus actually enter the ovaries and cause a lot of destruction and damage. So that's another reason why we're seeing this uptick in POI that's kind of independent of autoimmunity. And then we have what we call ovarian suppression, which is where that virus entering, creating damage, has caused this danger response in the ovary. And so the brain is trying to scream at the ovary to work, and it's not. It just has shut down to protect itself. In that situation, we can see very rapid changes in function using correcting inflammation, the gut microbiome, antioxidants, antiviral, like layering in those things. Because I've seen people, their FSH is at 40 and it comes down to 10. And their AFC is good, like they proceed forward and they're totally fine, but they needed to get out of that danger response. Whereas when we have a damage cycle, that's when it takes more effort and time to say, okay, how much is repairable here? How can we get you back to that ovulatory state? Because again, we know there's there's ovarian stem cells. Like all of this research is done. There's so much we can do, but to your exact point, healthy bodies get pregnant. And so we need to go through the 5 to 7 causes of disease and figure out which ones are related to you. And that's always what I navigate, right? There's only 5 to 7 causes of disease. That's it. People challenge me on this all the time. I train NDs and they're like, what about this? I'm like, it fits in here, right? But that you're right. It's such an empowering thing to go through a checklist and say, okay, do you have blood sugar dysregulation or insulin resistance? Do you have liver dysfunction? Right? What's going on with your immune system? And like true, like deep immune cells, neutrophils, lymphocytes, white blood cells, all the nerdy cells, antibodies, right? What's going on with your gut microbiome? What's happening with your nervous system? What's happening with your mitochondria? What's happening with your nutrients? B12, iron, right? All of these nutrients, even things like antioxidants, right? You go through that checklist and you can pick 2 or 3 things that are most prevalent for every patient and start there. And I think I'm so fortunate to have been so busy for so many years to now have so many clinics and practitioners and thousands of patients go through here. Health can be so simple. And I think there's a beauty in that. But when you're in the midst of what feels like crisis, it's almost hard to believe that there can be that degree of simplicity to it.
Yeah, it is, because I think in conventional medicine, if you're going to see your GP on this, you're just getting poor advice, right? And it's not about ignoring, the advice of your REI or your OBGYN, but you need to get a team here. And a lot of the times we're just thinking, what's the pill, or and some of this stuff, we're like, oh, do I want to make these changes? But this could be the change that's going to, shift the needle in the right way and help you get pregnant. And if the majority of us can get pregnant naturally, why are we all rushing over, to IVF and thinking that's what we need to do to get on the list for, IVF and PRP? And then it's just, the fertility industry now with all these add-ons and things they have with the embryo testing, and it's that kind of piece is there. But when people talk to me, it'll be like, they'll give me a whole list of what they're doing at the clinic. And I'm like, well, how's your health? And then they're like, well, I think it's okay. I'm like, again, back to that. Well, it wouldn't be okay if you've just done all of that piece and now it's not working. So we need to, like food sensitivities, gut infections, thyroid, blood sugar, like nutrient deficiencies, vaginal microbiome, like all the stuff that, it sounds like we're like, it's the same thing, right? It's being able to like dig deeper with this, be a detective, don't take no for an answer. And there is a reason. Like I had no clue when I was diagnosed with POI at 28 that there's something I could do. I just, when this is 25 years ago, people are like, didn't even know what I was talking about. It was just, there was these little chat rooms on the internet that wasn't even a thing, and trying to figure this piece out. Well, now there's almost too much information, and we got big pharma doing something. We got, all sorts of different, people saying, doing these carnivore diets or keto or like all
Yeah.
this generalized recommendations, right? Which just have you going down a rabbit hole. People are taking a massive boatload of supplements. Are
Yeah.
they against of expensive pee? There's
Yeah.
foundational supplements, but what are the supplements that are right for you? So it is to be able to, take your health in your own hands and dig in here. So what are we seeing? I guess is some of the, as far as, let's kind of go into those different pieces. So like chronic infections and
Mhm.
what are you seeing there? I guess as far as that gut dysbiosis, infections, things like that.
I always say, first and foremost, if all you have is a hammer, everything looks like a nail, right? And so with different systems of medicine, your GP has their scope, your REI has their scope. And even now, like there's the clash between the European standards and education for REIs and the North American standards. So we have a lot of clinics here, like we have a clinic down the road doing the immunological protocols with prednisone and tacrolimus and IVIG and all those types of things. So like they're coming in that direction to understand the immune system's component in all of it. And I always say, I'm like, Ed, I have a great relationship with the docs here. And so I'm like, okay, cool. And, right? Like, and it's, again, they don't have the background that we have. They don't have the time to research in that area. They're trying to stay up to date on what's improving efficacy rates and all these types of things. So it's such a balance, but you said it so well. It takes a team, right? And it takes a team that can communicate with each other, right? It takes a team. Even for me, I was working with a patient. She has endometriosis and a lot of stuff going on. And she tried for 5 years to get pregnant. And I was like, you need to get out of that fertility clinic. You need to transfer your embryos. We need to work on this for 3 to 6 months, get the viruses under control, get the gut microbiome in place, work on histamine, work on mitochondria, and then let's do a transfer using some of those immune support agents that I mentioned. And she's 38 weeks pregnant right now. I just saw her today, right? So there's such power in understanding how to navigate both worlds. But like I was talking to our acupuncturist today, he had a patient in and she had 70 follicles developing in an IVF cycle. 70. We were like, no, it's a mistake. It wasn't. Male factor. So it's like, that's a whole nother conversation, right? Of, okay, what's going on with ICSI and DNA fragmentation and what we need to know about there. But I'll stay on topic. I promise. It's hard, but I will. But when it comes to, oh, go ahead. Did you want to say something about that? I just, we're like, you can see us back here. We're bouncing.
But yeah, it's 50-50, even though we primarily deal with female factor fertility issues. We always will coach the couple because we can't just, and she'll be like, well, he's fine, he's okay. No, we need to look at his semen, look at his DNA fragmentation, especially if you've had recurrent miscarriage. It is not about myopically focusing on the woman. We need to look at his blood chemistry. And a lot of times, I'll ask the guy, oh, how's your semen? He's like, it looks good. I'm like, no, we need it tested. Like, what is going on, right? And the guys are open-minded. The ones that we
my favorite response I've ever heard.
You're like, what? It looks good. But the guys are open-minded. They're not necessarily given a plan, right? They're like, okay, don't sit in a hot tub, don't ride a bike, keep your
Don't
laptop.
cook your balls.
Yeah, exactly. Keep your phone out of your pocket, and there's nothing you can really do. But that is just not the case. So all the same things that we talk about with women, with infections, with blood sugar, with like the guy has to do too, and we want to get his semen in the optimal shape. So when you go and have, you're either getting pregnant naturally or you go to the clinic, you're going to have a beautiful embryo that's going to, we've had people,
absolutely,
horrible retrievals, nothing works, all the egg quality is bad, and the embryo is, testing abnormally. They both make the changes. Lo and behold,
Yeah.
they're pregnant. We have one right now, 34 weeks pregnant, where both of them, it was male factor and female, low AMH,
Yep.
whole thing. And, she's pregnant and she was told donor eggs, nothing
Absolutely.
was going to work. And
Yep.
so,
Absolutely.
yeah, it's like I've been doing this podcast for like almost like 6.5 years of like banging on the same stuff, and you just keep going because
Yeah.
there is a movement afoot here where people are taking their health in their own hands and prevention. And
Absolutely.
there's a huge clinic that just opened. I think the people that started Whole Foods, they have just opened up a longevity center in LA, which has the
Cool.
cryo centers, the
Yeah.
functional medicine docs. It has all this like
Yeah.
wellness and longevity piece because people want to live longer, but they don't want the last 10 years to be lying in a bed half dead, being not able to move. So like
Yeah.
we've got to take our health in our own hands. This is important for the health of our children, our children's children.
Yeah.
And so, yeah, like to me, it's like, is it like once you know this, you can't, like people tell us all the time, probably same as your clients, patients, it's life changing.
Yeah, absolutely. And I think we have, as a society, we have really skewed health and disease up until this point, right? People thought they were healthy until they had a disease. And with all of the research coming out now, talking about how the fact that we will have a longer lifespan and a shorter health span than the generation before us, and our kids are in that same boat, it's really causing people to sit up and say, what is that line between health and disease? Because it's not like long jump. You know what I mean? You just don't go from one to the other in the same day. So what does that look like? And how do we navigate there? And I think it's such a critical conversation because even for me, when I was doing research, one of the projects we looked at is metabolically healthy people, obese people, metabolically unhealthy obese people, metabolically healthy lean people, and metabolically unhealthy lean people. And we did their blood work. And so even with that, you'd see the ranges on the blood work. And then I was like, these are completely different. Like when we look at eliminating disease, eliminating this, eliminating that, there's a completely different range set. So I think I was so fortunate to go into naturopathic medicine with that knowledge base to be like, this is not the absence of health, is not the absence of disease, I guess is what I'm trying to say. And so we have people coming in now saying, okay, well, in my blood sugar, my average blood sugar, my HbA1c, as we call it, average blood sugar over 3 months is 5.7. But no one told me that was an issue yet. But it seems kind of high because it puts you in the at risk of diabetes camp. And I was like, that is very high. If it's over 5.3, it can affect your fertility, men or women. So people asking those questions, they're asking what's affecting my blood sugar. Well, then we go into insulin, which is a hormone that controls blood sugar, but it also controls inflammatory load, hormones. If you have acne, you probably have insulin resistance, right? It's controlling conception rates. We've seen higher levels of insulin, higher levels of like failed transfers. We see more miscarriage. So you go through that list, and the simplest blood work you get from your doctor can already be the breadcrumbs that lead you to questioning and getting more investigations and deeper levels of knowledge.
Yeah, and I've done many podcast episodes, like deep dives on blood sugar. It's a theme that we see all the time. I just spoke with someone the other day, and she's like, "I've got high blood pressure and I'm pre-diabetic,
Yeah.
and I don't know why this is not working." Well, like there's huge clues, and
Yeah.
diet and lifestyle. Like, otherwise, you're going to be thrown on metformin and have all kinds of side effects with that, and be on all sorts of medication the rest of your life. But there's things you can do to improve your health, which then
Yeah.
like what we want to prevent gestational diabetes,
Yeah.
preeclampsia, preterm labor, all that stuff, right? That we can sit here and think, we want to get pregnant, but we want to have a good pregnancy and not, there's the increase in pregnancy loss and stillbirth and all that stuff, which like is devastating.
Yeah. So I was talking to a patient yesterday about this, and she was saying that because she was an IVF pregnancy, she was put in a high risk camp. And so she was going to be induced at 38 weeks. She went to see a lactation consultant. They said, just so you know, you're an IVF pregnancy. So like the chances are you're going to struggle with lactation and this and that. And I said to her, I was like, no, stop. You are an IVF pregnancy because you started the IVF process before you saw me. You worked You did the work on your gut. You corrected your constipation. We supported your mitochondria. We corrected the gut microbiome and the immune status. She had very high CRP and ESR. They're markers of inflammation. She had what we call an altered neutrophil to lymphocyte ratio, which in the research is now being very associated with endometriosis, infertility, those types of things. All of that was corrected. And then you happened to have embryos. And so you went into a cycle. The average person going through IVF has PCOS, has thyroid conditions, has autoimmunity, have glucose dysregulation. They have those types of things. And so that puts them in a high risk camp. But you resolved those. You don't have preeclampsia. You don't have gestational hypertension. You don't have gestational diabetes. We don't take on that information you were just given as your reality and your truth because you're in a different situation.
Yeah, because she took, charge of her health, right? And didn't sit back because, when I was going through this, I wondered why, when I tried to breastfeed, I'm literally pumping like a wild woman and had such problems with, with the milk. At 4 months, I looked at my little daughter. I was like, oh my goodness, I think I'm starving this child. And I had to supplement with formula. I had no idea. And, I believe it was a thyroid that was off that I didn't know. And I had these food sensitivities and gut infections, all that stuff. And then it was years of me trying to figure this stuff out. But if you're listening to this podcast right now, we are helping you, like giving you the clues to be like, there's things to dig deeper and, let's take action. And so what are some tests that you're looking at here? What are you doing as far as lab tests? What are you seeing?
Yeah. So I always say starting with the basics is so helpful because with lab testing, even the conventional blood test that your medical doctor is going to run, things that you do here in Canada, it's Life Labs and Dynacare or Quest Diagnostics, right? These tests, whether ordered by a naturopathic doctor, functional medicine practitioner, even something so simple as what we call a complete blood count, which we all get when they tell you you're anemic. Right. You can track that over time. And like I said, that ratio between your two white blood cells, they're called neutrophils and lymphocytes, has immense amounts of research coming out on it to show that even just looking at that, if that's over 2.5 or 3, you have inflammation circulating in your body that's significant enough, it should be addressed. Full stop, point blank, done. And so I think when people think about testing, they think it's going to be insanely expensive. And God knows it can be thousands of dollars. I've spent thousands of dollars of testing on myself. It is worth every single penny, right? But you're never going in blind to anything. You just might need a different practitioner to look at it. Because even for myself, I was in the hospital a while ago now, but I had a flare of endo and I needed to make sure I didn't have ovarian torsion because way back in the day, I had a 10 centimeter endometrioma. Now I don't, which they also tell you is not possible to reverse. But, and so I was like, I just want to make sure I don't have torsion. My NLR, neutrophil to lymphocyte ratio, was consistently 1. Then it was 2. And in the hospital, it was like 6. No one viewed that as a concern. Now, I'm very fortunate. I know how to treat that, right? I was like, oh, okay, I recently had a virus. I need antivirals. I need glutathione in the mix. I need to get in my proteolytic enzymes to break down inflammatory complexes. Like I knew how to navigate that. But I think even just having the blood work in the right hands of the right person, a basic blood count, looking at, as I talked about before, erythrocyte sedimentation rate. That's a general marker of inflammation in the body. C-reactive protein is a marker of gut, metabolic, and liver inflammation. We have complement, right? These are systems in the body that are used up when we have infections. We can do a liver panel. We can do blood sugar monitoring and insulin testing. We love a 2-hour insulin glucose challenge test here. It's similar to the pregnancy one, but you measure insulin after you eat. Because how many of us spend our whole day fasting? No one, right? You need to look at what happens when you eat. So there are tests that you can get done in the range, even paying privately, less than $100, less than $200, less than, you know what I mean? You can pick your price point and still get very valuable data, especially when we're comparing over time. And then that's, of course, in addition to the antibodies we already talked about for thorough autoimmune assessments.
Yeah. And then I think doing vitamin D and iron and, the rest, those folate, zinc, vitamin C, magnesium, some of these other ones where we could be supplementing with that, but we're, with D, a lot of with AMH And
Yeah.
vitamin D is highly correlated. And if that, we see that super low on a lot of people, and you
All
want
the
to
time.
have it higher.
Yeah,
Because conventional
absolutely.
medicine is just going to miss the boat on that. Um, and then any other testing then you would look at then to start
Yeah, so
lab testing?
exactly, like a good workout is looking at a CBC, as we call it. If anyone's making a list here, let's rock our list, right? We've got our CBC. I look at iron over ferritin because iron is actually used up by viruses. And so in our pelvic inflammatory patients, iron can cycle a lot. It can go high over 30 and then down to 10 and then up and down. So we look at that. Ferritin is just a marker of liver inflammation at the end of the day. It can be a marker of iron storage, but it's often a marker of liver inflammation. So we're looking at that. B vitamins, vitamin D, those are big ones. Liver panel, including something called GGT. GGT is a marker of glutathione recycling. This is what I mean. Like, you can get very advanced with basic testing. We need to see what your cholesterol is doing and how your body is using that fat. That's very important. We look at insulin. And then, like I said, we're looking at antibodies. We're looking at the complement, CRP, ESR. And then sometimes we'll get into gut microbiome testing. Vaginal microbiome testing can be so helpful, as you mentioned earlier. So there's this whole spectrum that you can open up. And it really depends on where patients coming at, right? I have patients that have spent hundreds of thousands of dollars on fertility treatments. And so they come in the door and they're like, listen, I am 40 years old. You know what I mean? Like, I have this many embryos left. I want to take 6 months and do everything I possibly can. And so there we're testing as much as we can to get action as quick as we can. But it's really dependent on the patient. And I always say to people, I never want someone to feel like, obviously there are some reasons that cost is the reason you can't access care, but there's this feeling with our professions that it's going to be like $10,000, $15,000, and it does not have to be. We could always customize and work with what you've got. Even honestly, the most empowering dietary changes can be all it takes. Like supplement or two, because no one's getting enough vitamin D here. You could run around naked in July 12 hours a day and you do not have enough vitamin D for the year, right? So there's those critical ones, but then there's also so much that we can do with those foundational elements. I think it can feel so overwhelming. And I always say to people, my job is to simplify it, right? My job is to take in all the information and work with you to create a plan that creates simplicity.
Yeah, just saying, yeah, it's all about customizing it, right? To being able to see what's going to work for someone. Because some people have spent all this money over with IVF and IUI, PRP, all the rest of it. And now you're like, oh, I got to spend all this over here. So unfortunately, you can get things covered by, HSA and things like that. But it is, especially in Canada, the interesting thing with our medical system, we think it's free, right? But
Yeah.
free does not equal good. And if you want any kind of decent care here, you have to pay for it. I think people in the States inherently already understand that and
Yeah.
know that that they need to pay out of pocket for things. Obviously you want to try to use your insurance as much as possible. Some of our tests are, we can use HSA in some of our program as well, but
Yeah.
it's not about, like you said, it's not about more and pushing all this stuff at you, right? It's being able to customize and kind of meet people where they are. And like, I've got people that listen to all my free stuff and just make some of the diet changes and tell me they're pregnant just by going gluten-free.
Absolutely. And I think that is fundamentally why I got into naturopathic medicine. Is I am the type of person who needs a really big toolkit, and I need to follow the research, and I need to be empowered in that. And even now, so in Ontario, I practice in Ontario, Canada, naturopathic doctors have a pretty small prescribing scope. In British Columbia, they're primary care providers. That's where some of my other clinics are. So it's different depending on where you are, what the scope is. But the docs in town are great. Like, they get to know you, right? And I have specialists that I've worked with all over, and I'll be like, can we try these pharmaceuticals? Can we try this approach? Can we consider this while we're doing this? And so I think it's also working within your healthcare team to say, okay, if we can't resource it this way, what can we do here? And like move around like that, which is so important.
Yeah, same here. I have a network, right? Because sometimes we do need a bioidentical, or sometimes we do need thyroid medication, or maybe the parasite is so strong that we want to use it, anti-parasitic. It's not our first
Yeah,
go-to, but we need to, weigh things out.
absolutely.
Maybe H. pylori's got like a really high virulence factor. So we need to, so it's not with functional medicine, functional nutrition, it's not excluding, the tools of conventional medicine. We're not just going to close
Yeah,
our eyes and say, hey, the last 100 years, nothing is there. But it's a lot of the times now it feels like we just think we need the pill. Like, what's the fast
yeah,
track? Meanwhile,
yeah.
that piece along with the diet and lifestyle changes, to be able to make those changes. Okay, and so where can they find you? So they can find you here at advancedwomenshealth.ca/FabFertile, and we'll have that link in the show notes. And what can they expect there? I think you've got a number of clinics you're saying, and that, yeah.
Yeah. So that's where I always say I'm the owner, but I'm also the message passer. Yeah. For with Advanced Women's Health. So we have 9, soon to be 10 clinics at the time of this recording. And our team really functions based on clinical excellence. So you don't have to work with me to get this knowledge. Everyone goes through a 9-month onboarding as they come in. We have daily clinical rounds because we get really complex, beautiful patients that come through. And so we need to have our practitioners have a really high level standard of care. So right now we are providing care within Ontario and BC, but stay tuned on there. It'll let you know as soon as we have Alberta and other places. And then I actually train naturopathic doctors on evidence-based principles. For all of your US listeners, I'll be able to help them navigate and find someone as well, because I do have people from there. But I think fundamentally, what I want people to take away and what I want people to know is that that niggling feeling you have inside you that there must be something different, there must be something more, that this can't be your destiny, is right. And just because you haven't found the right person or practitioner doesn't mean you're not worth trying again and dedicating again. And I know it's hard. I've been the person who put my faith in something that didn't work. I know it's hard, but I can also tell you, as someone who now has 2 children, as someone who is not in chronic pain on a day-to-day basis anymore, as someone who has endo and doesn't have to take Advil with their period every single month, it's so worth it. It's so worth it. And that's why I do these podcasts. And that's why I want to educate, because if you took one aha moment, if you took one thing that was like, I've never heard this in that way, and that clicked, then all of our time is worth it, because that's how women get empowered. That's how they get a voice. That's how they get started and take action, right? And start to go down that rabbit hole of health. And that's fundamentally what I want for people.
I love it. I was going to have you just do some final thoughts, but I think you just did it.
Jumped ahead.
That was awesome. Anything else?
No, I think that's all. I just want to thank you for doing the work you're doing. I have been referring to your website for years, right? And for people who have that low AMH and the high FSH, and they're looking for resources and support. And I don't think people are talking about it as openly as you do and as empowering as you do. And it's such important work. And so I'm so grateful to be here.
Awesome. Thanks for coming. Take care.